Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back, COIQ listeners. On today's show, we're speaking with Dr. Tal Rapke, who's a medical doctor. He also was a chief innovation officer at Sanofi, and most currently, he is the founder of ScalaMed. Welcome to the show.
Thank you so much for having me, Roxy. It's great to be here and talk.
Awesome. So I thought maybe we just kind of kick off by you kind of telling us a little bit about your background and what you're doing these days. And that might give the audience listeners an opportunity to kind of just to know you a little bit more.
Yeah, no, totally. I guess I've been on quite an interesting journey of trying to, I sort of describe it as a bit of an approach to understand the true consumer journey when it comes to healthcare. I think, I've spent many years as a physician. I've spent years on the digital side where I saw patients trying to search and understand their conditions. I spent years in pharmaceuticals where we were trying to innovate and understand how people actually take the medications and why, and how do we give people the same feeling of great health outcomes, but also support them in their journey through ill health. And throughout that, I guess, entire experience in healthcare, I've been really focused on the fact that we have a healthcare system that was created or set up in an age where consumers or patients didn't have the knowledge, didn't have access to information, and where people, for the most part, we're kind of like what we call patients, right? You have to be patient. You've got to sit there and wait. And I've been, over the last sort of years, been thinking really about how do we start creating a much more intuitive, empowering system that really ultimately helps people live healthier and more fulfilling lives. And so, yeah, I guess, my background has been varied, and, I've been very lucky and had some really cool opportunities in entrepreneurship, in large healthcare businesses and digital health. But when it comes down to it, I think my real passion is to try and make a dent in healthcare and help people help people make healthcare a little bit easier.
So what is it like for you riding this roller coaster of healthcare innovation?
Yeah, look, it's a great question. I mean, I think I definitely, some days I find myself screaming, kind of, muffled, like, oh, why is it so frustrating? I mean, other days I'm really inspired. And I think, it's interesting, even I've seen changes even over the last sort of 3 to 6 months, where previously when I used to speak about the consumer experience of healthcare, or the fact that, managing one's health is hard, people were always like, yeah, it's not really interested. But I think there's been a real shift as, we see a few things coming to the fore. I think as we start seeing value-based healthcare, so moving away from volume and moving towards value in the US healthcare system, I think people are really starting now to realize that we need to start bringing patients along the journey, and we need to start thinking more about outcomes rather than just about inputs. I think innovation is definitely a buzzword in healthcare, but I actually think there is a true appetite to change. We can't keep increasing the cost of healthcare. I think we're seeing, large out-of-pocket deductible plans. So consumers and people who are living with healthcare are now realizing the actual cost of their healthcare and are now becoming more savvy as to what they're receiving and the value that they're getting out of healthcare. So I think there's been a real change, there's been a real appetite for innovation. But at the end of the day, I guess I, like many others in healthcare, apply a very easy formula to innovation. And that formula is the triple aim, or as some call it now, the quadruple aim of healthcare. And your readers, I'm sure, or your listeners are probably very familiar with this, but I always feel like innovation is, if you're driving down the cost of healthcare, if you're improving the experience of healthcare, and if you're delivering outcomes in healthcare, you're on the right trajectory. And the fourth one is, if you can actually help doctors out and you can actually help the system out by reducing some of the friction and the workload and the administration burden, then really what you have is a truly scalable innovation in healthcare. And so for me, I think innovation is kind of easy in that if you apply that filter to anything that we do in healthcare, I think that's the filter that I always encourage innovators to apply to anything that they're thinking about.
Mm-hmm. Yeah, well, I will definitely agree with you. I mean, we are closer today to adoption of innovation more so than we ever have been. I think the last few years there's been a lot of talk about innovation, and so we're just seeing kind of an uptick, and it seems like we're getting closer and closer to that time where more transformation and adoption is really going to take place. I'm interested. From your perspective, there's a lot of physicians that have turned entrepreneur. What are the advantages or disadvantages of that dynamic?
Yeah, look, I mean, I think at the end of the day, healthcare is complex, right? It's a profession that we're trained as kind of apprentices in healthcare. It's not a standard course that you go to university. It's really this idea that you're spending time in hospital, you're engaging with patients, you're watching and you're observing. So there is a language. We speak in Latin. A lot of our language. We need to think. There's complexity around financials and other bits and pieces. So I think having that, being able to be on the front line and speak to a clinic or speak to a physician or speak to a hospital group and even a payer, and have some credibility as someone who's been through the system and seen what it's like to be on the front line, I think is helpful. I wouldn't dissuade people who don't have that experience to not jump in, but I do think it's important to understand how healthcare thinks, and I think having that physician training is an advantage. That said, I also think that the healthcare system and my training, and I can only speak to my training in healthcare, we're also trained quite algorithmically. So healthcare, as an apprenticeship, as a training course, we're taught to think about problems in a very linear and method, a certain method to the madness of medicine. Mm-hmm. And I think that sometimes can actually get in the way of true innovation, because sometimes we need to think creatively, and sometimes there are other approaches. And so I think trying to as a doctor who's been trained, classically, I think trying to apply innovation can sometimes be hard for some people. That said, I think it's a great profession. I think taking a medical degree and then applying it innovatively to solve some of the big intractable healthcare problems is a really satisfying and rewarding career. And it means that rather than having an impact on a patient-by-patient basis, you can have a greater impact on a much larger patient population. And that's, for me, is a real driver.
Yep, absolutely. So, as a physician, I imagine that you're just completely immersed in the healthcare system, right? And so you're identifying problems just in your day-to-day practice. And as you identify those, it seems like it's common for a physician to decide that I've got an idea for a solution to solve that problem, and then, turn into an entrepreneur and decide to launch this innovation and help our audience understand what are maybe some of the misnomers of, okay, I'm a physician, I understand the problem, I've got a really good solution, I'm very familiar with this dynamic. So I feel like I'm really comfortable with problem solution fit, or product market fit. And now I'm going to go to market and I'm going to be successful. And then reality hits, so kind of just talk about that a little bit of what's the reality of going to market and trying to commercialize an innovation, even if you have something that is superior to what's being done currently in the marketplace.
Yeah, that's a great question. So I think healthcare is a very evidence-driven profession, right? So there have been many promises of amazing technologies, amazing, pharmaceuticals, amazing devices that have a great promise and that sound really good. And then when you actually put them into proper clinical research, double-blinded, randomized, controlled, gold standard studies, we actually find they don't perform as well as we thought they would. So there is something about healthcare that the stakes are high. If you screw up, at the end of the day, you're impacting someone's life. And so, so I guess as a physician, it's a really, it's part of the philosophy is we are an overly cautious group because, like I said, there are high stakes. So I think one of the things that we've been focused on at ScalaMed has been, when it comes back to sort of problem solution, is really trying to think about the entire flow of that system. How are we impacting the workflow of the clinician? What does the clinician need to change in order to apply this particular solution? What are the risks that they're putting to a patient? What are we taking them away from that could potentially have a greater impact? So if you're saying to a doctor, listen, you've got, certain number of hours in a day that you can perform activity and care activities. Firstly, we need to make sure that you're getting paid appropriately for those activities. But secondly, should I be calling a patient or should I be working on this tool? Should I be typing something into a computer or should I be running this particular diagnostic test? And at every decision point, we need to make sure that people are focusing on the most impactful things to drive and deliver good healthcare. And so I think as we thought about our solution, we wanted to find a solution with ScalaMed that would ultimately deliver great outcomes to patients, again, along the triple aim of healthcare, that wouldn't interfere with the workflow of the doctor, would actually make their, improve the efficiency of their workflow, and create a lot of automation behind the doors to actually make sure that we can deliver and execute against our vision. And so I encourage people when they think about a great solution is, if that solution just helps one individual within the healthcare system, so just helps the doctor with their efficiency, you've always got to think about, is someone willing to pay for it? What does it do to patient health? What does it do to the experience of healthcare? Does it reduce, administration burden? And I think we know when we've looked back at all of the litany of digital health failures or innovations that, on paper were amazing technology and brilliant ideas, a lot of them relied on changing workflow. And the value that it brought to the system just wasn't there. And so, we are creatures of habit, physicians. We know workflow is important. When you're sitting in front of a patient, you've got an EMR system that's throwing up 1,000 pieces of content and information at you. You've got a patient with, printouts from Google and a litany of problems. You've got, your phone buzzing and ringing, and, you kind of got to break through that clutter to really have something that's truly impactful and solves those moments of care. And so I guess, I don't know that I have a formula for how to take a problem and solve it, but I do think there are a lot of things that we need to think about. And I think the more that innovators think about all the elements of a system, I think they're more likely to be successful in solving those problems.
Absolutely. So you kind of touched on this a little bit. What drove you to build ScalaMed?
Yeah, so I guess I being on the front line in hospital and seeing patients come into hospital for preventable health issues. So I took too much medicine, or I missed my dose of medicine yesterday because the pharmacy was closed at 6 p.m. at night and I couldn't get my new pills, or my prescription was stuck in a pharmacy that's it's no longer near me, or I don't know, like I lost my prescription, or I'd see patients coming to the emergency department all the time with side effects from medicines that they should never have been prescribed in the first place, or with interactions or medications that they were allergic to that just weren't, the right questions weren't asked. So that on the front line, I thought, oh my God, this is awful. And shamefully was completely preventable. And then I'd see it, we know in the pharmaceutical industry, we had amazing products that have amazing impact on people's lives, and people just didn't take them. We saw 30% of patients not picking up their first prescription. We saw 50% of patients stop taking chronic medications for high blood pressure to prevent strokes, to prevent heart attacks. They would stop taking those by 6 months. And we would see this, and financially that was a huge impact, but just the ability to be able to help patients, it was there, but it was untapped. And so I think seeing things from those different perspectives, and then seeing how patients behaved online, searching for content and trying to understand the pills that they were prescribed by a doctor in a very limited amount of time, and just not understanding why it was so important to remain on therapy. I realized there's actually a better way to help support patients with medication management. And I think, when and having chronic disease myself, and having family members who have suffered with illnesses, and seeing it also from the perspective of the patient, I've just always known there's a much better way. And so this has been a bit of a passion project coming from various parts of my professional career, coming together to say we can do better when it comes to medication management. It's over a $300 billion problem annually. It individually affects people's lives. It disrupts their ability to be parents and grandparents and lead fulfilling lives. And I think that's where we really came about. We can actually do a lot better when it comes to medication management. And so, yeah, we spend a lot of time understanding the problem. We spend a lot of time trying to work out what is the system currently doing. And we went back to the drawing board and thought, actually, there is a much smarter way to think about prescriptions that is engaging, that is empowering, and that ultimately prevents hospitalizations and prevents the morbidity and mortality associated with medical mismanagement.
So one of the things that I think is most fascinating when I hear you speak is you first and foremost are talking about the problems that you solve, the jobs that people are wanting to get done, and what they were doing previously to get that job done, and what they could possibly do with your solution. And I think that although it's really semantics, it's the complete game changer in the commercialization process, because most people, most innovators, when they're asked to describe what drove them to create their innovation, they start talking about the features and functionality of the product. They really focus on what it is that they're bringing to market, and they think about it from the product lens as opposed to the problem solution lens, the job that they are the job that people are hiring their product to do. And I just think that makes a world of difference. I hope our listeners take note to that, because that is fundamental to being able to achieve commercial success.
I fully agree.
Yeah. So one of the things that I think is really interesting is I was doing a little bit of research about you. I noticed that you took a sabbatical for almost a year. And I think that that's kind of interesting in the entrepreneurial journey. So how did the sabbatical influence where you are today?
Yeah, I mean, look, so I like the analogy of the snow cone. The little sort of glass, touristy things that you pick up when you go to New York or when you're traveling around the world, and you sort of shake the snow cone. And so in my life, I quite like this idea of, I'm on a track. I was a physician for a bunch of years, and sort of, then I moved into, digital health, and I was in pharma, and I did all those probably for a similar amount of time, like sort of like this 7-year itch. And every 7 years or so, I just like to sort of stand back from my life and shake that proverbial snow cone and see where it all falls. Because at the end of the day, life's short, and we've got to be waking up every morning and making sure that we're focusing on the things that are important to us. And so for me, it was a really awesome opportunity, firstly, to show and spend real quality time with my family, being able to get up in the morning without the distraction of technology, look at my kids in the eye and be able to just, spend quality time with them and let them direct the day and the play. I feel like we live our lives in these sort of 6-minute increments of running from one thing to the next thing. And so to me, it was an opportunity just to stand back and think what was important to me. And I think during that time as well, in the spaces, it gave me an opportunity to start thinking about ScalaMed as well. And I started really researching and understanding the problem and speaking to people. And so it was a sabbatical, but it was a really chance to clear my mind and hopefully see things a little bit differently than others do. And I think when we're in the detail, it's very hard to sort of pull ourselves out and see a much bigger picture and see other opportunities. And so for me, the sabbatical was rejuvenating. I came back with an incredible amount of energy and passion to make a difference. But it also allowed me, I think, to see things that I may not have been able to see without having taken that break. And,
That's awesome.
I think the fear of taking time off, and I had this same fear, so I acknowledge it, was oh my God, people are getting ahead, or people are moving ahead in life, and I'm, stagnating, and I'm taking a step backwards. And, I'd watch friends and people, move up in their careers, or take additional steps, or, buy their next holiday home, or do things that to me are not really important when it comes down to the things that are important in life. But there is this feeling that you're standing back and people are going to forget me, and my LinkedIn's going to go dry.
Right. Am I going to be relevant?
Am I going to be relevant? And oh my God. And firstly, the nice thing about healthcare is it just doesn't move that fast. But I think it also, coming back with a rejuvenation to me is incredibly valuable. So yeah, I'm a big firm believer in taking a break, re-looking at life importantly, and doing so consciously. I think the more we're conscious of what we do and what we want to do in this world, I think we're able to have a greater impact.
That's awesome. And, I think that point can't be communicated often enough. And kudos to you for, having the mindset to see the value in that, and then having the courage to actually take it, invest in your family and invest in yourself. I talk about this a lot in some of my blog content around, innovators encountering this trough of sorrow or the valley of death, all these doom and gloom things, just the reality of entrepreneurship, because it's so difficult. And so many innovators, I think that they need to work 60 or 80 hours a week in order to be successful, right? And never take a day off, and kind of wear that as a badge of honor, and really proud. And quite honestly, over the years, as I've worked with health innovators, those that do, not necessarily a year sabbatical, but those that do those types of things, eating healthy, going to the gym, this idea of, self-care and taking time for themselves, really, they're the ones that are more successful. They're the ones that are having a lot more success than the ones that are kind of just grinding day and night.
Yeah, look, I always like that. I like this idea that, if you want something done, you give it to someone who's busy, right? So when your life's full with family and, many things going on as an entrepreneur, it is a full-time, it's sort of it's a two full-time jobs. But
right.
You're right. Look, I spend a lot of time also, wasting time and spinning my wheels and doing things that probably aren't the most important thing. And I think, just being able to stand back every day as an entrepreneur and what's the most important thing I can do today to have an impact, I think is valuable. Look, there's no escaping it. It is hard work. I think it's also a roller coaster, right? So I sort of joke that, some days I'm like, screaming, ecstasy, like, yeah, woohoo, yeah. And then the next minute it's like, wah! And so, it's this roller coaster. And I think for me, at least, it was part of, taking that time off and doing a lot of yoga and meditation and, getting mentally really clear, I think has enabled me to be a lot more equanimous with the journey and enjoy the peaks and the troughs, but just observe it a lot more and not get as frustrated or as broken about it, because that is really stressful. And so I think, look, it's a long game. I think someone gave me some really good advice when I started this entrepreneurship journey, because I think when initially I started, I was like one of those 80-hour or more a week people, and kind of bug-eyed, and so I was just like, look, Tal, it's a marathon, it's not a sprint. And I think there are definitely moments where we sprint, but I think kind of embracing that idea that this is for the long term, and to get through this, you need to be healthy in spirit and mind, and it's important to look after what's important, because at the end of the day, right, the people. I think Steve Jobs said it right when he was on his deathbed. He was like, this is the most expensive, hospital bed in the world, and really the things that are most important are the people standing around me. So, that said, it also feels really good if you can get to the end of our days and look back and feel like you've made a dent in healthcare. And that's something that I'd love to be able to achieve. Just a little bit of a dent, just making it just a little bit easier for people, making it just knowing that you've touched a few people's lives and made their experience of healthcare just that much better. That would be an achievement.
That's wonderful. I know you will. I have every bit of confidence. So a couple other questions that I have for you that I wanted to kind of talk about that I think our listeners would be interested in. So I've heard you make this comment of, kind of launching ScalaMed in 3 hours. But then the idea of the amount, what is it going to take to be successful was very, very different. So kind of just speak to that a little bit.
Yeah, so maybe I can talk a little about what we're doing at ScalaMed, and then sort of I guess our pathway to how we're having an impact, and hopefully that will give you answer some of that. So we're one of the big changes that's happening in the American healthcare space, and really globally, is a movement, like I said, towards value. And in the past, we had a fee-for-service model, right, where you could go to a doctor and, if your blood pressure was managed well afterwards or wasn't managed well, you got the same fee. And so as we move to a system where our payers, where our hospital groups and our clinics are ultimately taking on responsibility for our patients' health, they're being driven to ensure that patients stay out of hospital and remain healthy. And one of the large causes of hospitalizations, one of the huge burdens in healthcare cost is medication mismanagement. And some actually quote and say that that if it was a disease, it would be the third biggest or third most expensive disease that we have after heart attacks and cancer. Heart disease and cancer. So medication mismanagement, medication issues and side effects is a huge burden. Mm-hmm. And so now we've got clinics, using their tools of the trade, like medications, and giving them to patients and letting them go back into the community. But what we realized is that as patients, we're on our own 99.8% of the year, right? And we're taking our meds. We're often not exactly sure what we should be doing and how to take them correctly. The average citizen is seeing 3 different doctors across 3 different healthcare systems. And our system today doesn't really support patients once they leave the clinic to the same extent. And so we thought, what if we create a system that clinics could use that actually helps them be doctors and helps them support their patients when they're not there? And so ScalaMed's kind of evolved into this virtual care coordination for medications. We have a system today that we ask patients to be responsible for their medications, but we don't have a system that equips them to take on that responsibility effectively. And that's what ScalaMed does. It's something that the clinics prescribe. It's a new way for patients to manage their prescriptions on their phone. I kind of joke that, healthcare is one of the only examples, or medication management is one of the only examples today with electronic prescribing, where you go to a clinic, the doctor says to you, Roxy, which is your pharmacy? And you're like, it's the Walgreens across the road from me. And before you know that you're going to need a pill, before you know what the pharmacy opening hours are, before you know what the medication is that you're going to be prescribed, before you know what the cost of it's going to be, you've agreed that that's where you're going to go and buy your medicine. That to me is just the craziest thing in a generation of Amazon. And then not just that, the second you've sent your pill there, you sometimes don't even know the name of what it is that you're going to pick up. And so we say, well, why are we ignoring the most important person in the healthcare in this healthcare journey? Let's give those prescriptions, like we used to do with paper, to the patient. And rather than giving them paper, which we lose and bad characters can change or can defraud in some way, what if we give you a true, unique digital prescription that sits on your phone, that is smart, that tells you why you should be taking it, that educates you, that reminds you, that warns you, that gives you price comparison, and that essentially makes the management of your prescriptions completely seamless, like everything else we do in our technology world. And that's what ScalaMed does, and we do this with a really smart back end that makes sure we understand your challenges, we understand your unique issues with medication management. And when you're struggling or when you need help, we help link you back into care so that your clinic and your clinicians can help support you with your medication needs. And so that sort of holistic system is what we've been doing, I guess, with ScalaMed. And we're starting to see impacts in preventing hospitalizations, in making sure patients aren't prescribed medicines that they shouldn't be prescribed, and giving people visibility on what maybe some other options are that they could be taking instead of this one if it's expensive or if value is an issue. So it's starting to really change the dialogue and trying to increase the empowerment that patients have in their own healthcare journey.
Mm-hmm. Mm-hmm.
Now, I completely lost track of the question that you asked because I was so engrossed in my own telling of this story. But
I love it. I love it, though. I mean, I'm really excited about what you all are doing. I think it's very unique and different. There's a lot of tools and technologies that are out there that are trying to solve the medication adherence problem and medication management problem. But I think that the way you all do it is so unique, and it's really putting that patient at the center. And so it's really powerful. So the last question I have for you, and I know all of our listeners has absolutely heard your accent.
Yeah.
So one of the things that I think is interesting about your story is that, you know, you're from Australia and you're launching your innovation in the US market. So, you know, most of the innovators that I'm talking to and working with, you know, when we're talking about global strategies, we're talking about how are we going to penetrate markets outside of the US, and you've kind of take that and flipped it down and flipped it upside down, and you're like, okay, how are we going to go global, and how are we going to penetrate the US market? So talk about that a little bit. What is it like, you know, coming in and looking at the US as a global market and trying to expand?
Yeah, look, it's a great question. So firstly, I mean, I've lived in the US for 5 or 6 years of my life. It's a place I absolutely love. It's a place that's very dear to me. I think it's a country that's built on innovation. It's built on, you know, belief in oneself and belief that we can all have an impact and make a change in this world. And for me, that idea of, you know, those ideas just resonate with me beautifully. And so I think, you know, it's always a great place to do business, but it's a great place to be able to have an impact. And I find there's a real appetite for innovation here that it doesn't always exist in every part of the world.
Sure.
I guess what, you know, the reason we're doing work in the US is because it really is a big problem here, and the ability to have an impact is absolutely massive. So you know, yeah, coming into the US market, like I said, it's a place that's very familiar to me. I know I speak with, you know, a little bit of a funny accent, and there are definitely words that I use that I still, even when I go to a bar and I ask for a beer, people look at me and they're like, "Oh, a who?" I'm like, "A beer," and they're like, "Oh, what?" I'm like, "A beer." Anyway, so there are cultural differences, but at the end of the day, you know, the experience of being a consumer of healthcare, the experience of being a patient, the experience of being a doctor, are very similar globally, and I think the system here is really open to the innovation that we're presenting here. And I think US is actually taking some really some large forward steps towards value, which is what we really believe in. And so it's a natural extension of for us. And, you know, we're just excited to be in this market.
That's great. So the last question that I have for you is, there are fellow entrepreneurs that are listening, healthcare innovators in the trenches right now. What is the advice that you have for them?
Great question. Look, I'm not sure that I can give. I'm sure that people have given better advice than this, but I think my advice is general. Is, you know, one of our really important values that we have at ScalaMed is curiosity. And I think, you know, being really curious in healthcare, asking lots of questions, not going in with any assumptions, to your earlier point, solving a problem or trying to understand, really being curious about what is the actual problem, and keep on asking that question of, but why? And I think when we keep doing that, I think curiosity is just an invaluable tool for entrepreneurship. And so for innovators, ask lots of questions. I would say, you know, the US is a big market. You're going to get 20 no's, you're going to get 50 no's, and you're just going to keep on iterating on on the solution. And I think if you really truly are solving a problem, if you're aligning yourself to the triple and quadruple aims of healthcare, I would say, you know, keep persevering, because, you know, again, like I said, if you're focused on the right things, then you will succeed.
That's awesome. Thank you so much for your time today and for sharing your wisdom with our audience. I really appreciate it. So how can folks who are listening get a hold of you? Maybe if they have some questions about you, about your journey, about your ScalaMed solution, how would they get in contact with you?
Perfect. Well, first, I'd encourage anybody who's managing prescriptions, or anyone who's ever had a prescription sent to a pharmacy that's closed or out of stock, or the price is wrong, or just wants to feel a little bit more in control of their meds, to go and download the ScalaMed app. That's ScalaMed, the ScalaMed app. And in the next few months, you'll be able to ask any doctor in the States for your prescriptions to be sent to ScalaMed, and you'll be able to receive them directly to your phone. So that would be the best way you can get involved and experience it for yourself. But if you want to get in touch with me, LinkedIn's probably the best tool. You can find me there. Please reach out. I'd love to hear from you. I'd love to hear your feedback. I'd love to answer and support anyone on their journey as well. So that's probably the best tool.
Wonderful. Thank you so much. I appreciate you, and have a great week.
Awesome. Thank you so much for the opportunity to share, Roxy.
Bye-bye.
Bye.
What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization, and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.